People come to me because I'm the last stop. I'll find the answer. I won't settle.
Welcome to this week's Escape Your Limits podcast, and today we interview a medical doctor with a revolutionary approach to health, wellness and longevity called muscle-centric medicine. In this episode, we break the stereotypes surrounding building muscle, good and bad proteins, animals over plants, and how to deal with obesity as a nation. So for a lesson in what we can all do to improve the long-term health of ourselves and our community, then please check out this week's episode with Dr. Gabrielle Lyon. So Gabrielle, thanks for inviting me into your beautiful apartment here. For those of you who can't see or listening, we've sort of got the beach and the ocean behind us, and it's kind of a pretty nice sunny clear day, and we're outside on the balcony. So.
Yeah. Thanks so much for coming down.
Yeah, you're welcome. So what's the obsession about muscle?
Yeah, it's a long obsession. You know, I think at the heart of every obsession is, you know, depending on the kind of person you are, you want to see a change for people. So the beginning of muscle started with my own body. I was so interested in the capacity to change body composition. And then, as you know, right, we were kind of chatting before, I did my training, my undergraduate training in vitamin mineral metabolism and protein with Dr. Donald Layman. And he was really big into muscle. And that really changed the trajectory of what I thought health was. That's really when it started.
And the gentleman, because I've when I was researching, I tried to find out a little bit about him. So he's like he's a bit of a guru for people who know it. Is that right? Tell me a bit about.
So Dr. Donald Layman is one of the world leading protein experts. He's recognized by many academic professionals. So it's really interesting. There's the academic group, which those are the thinkers. Those are the ones that create the questions and the good science. And he's one of them. He's very well published, very well respected, and they live in what's called kind of an ivory tower, where they do their experiments, they learn, and then they do their best to provide information for practitioners like myself and other people to be able to move the needle.
Right.
Yeah.
So when you studied that, I guess when you think of muscle and I guess protein, you sort of think of the fit, the bodybuilding, but you you didn't start there, did you?
I did start there.
Oh, you did you?
I did start there. I was very interested in fitness, figure, bodybuilding. Yes, I was very interested personally.
Right, okay.
But then what happens is, of course, as we all mature, it becomes less about us and more about other people. And I ended up doing my fellowship. So I went to medical school, did a few residencies, and then did a fellowship. And the fellowship was in obesity medicine and geriatrics.
Right.
And I did that at WashU. And that is really where the concept of muscle-centric medicine, which is the kind of medicine that I practice, was born. And I saw at one end of the spectrum was this aging group, right? So geriatrics, aging, end of life. And then the obesity group, which was largely midlife. And the one thing that I really noticed when I thought about root cause approach was the fact that their body compositions were off on both ends of the spectrum. And when we would image individuals' brains, the wider the waistline, the lower the brain volume. That's wild. It was all about body composition. And so muscle, I realized, was not just this thing for locomotion, which of course it is, arguably it is, and everyone wants to look good in a bikini, but it was so much more than that. It's this endocrine organ, and it's so underappreciated. And that's what was so fascinating, is that while being fit and looking good are so, important, or at least the being fit part, looking good also important, I suppose, but it was the metabolic aspects of muscle that were really valuable. And when you think about truly being able to have any kind of control about the way you age, it's muscle. Right.
So I've heard you on some other interviews talking about the brain link, and as you brought it up, so what does that actually mean? You say the brain density is less. Are you saying that, in a layman's terms, if you're overweight, that you're probably not, your brain's not kind of working in the same way as people that are fit and healthy? Is that right? Or?
So yes, and I will say that that Alzheimer's disease is type 3 diabetes of the brain. Right. Just to put it really simply, that these metabolic issues, this metabolic dysregulation that happens with our body, just as much happen with our brain. So there are insulin receptors in the brain. The brain is exquisitely sensitive to inflammation and just destruction of that matter. And by optimizing metabolism through muscle, you have the capacity to protect your brain.
Right.
So it's interesting. We often think, or a lot of geriatricians feel, that Alzheimer's is, people, you're going to get it. You're going to get old enough, you're going to get it. And arguably, that's not always true. So when you think about optimizing muscle mass midlife, it is about optimizing brain function. So when I mentioned that comment that the wider the waistline, the lower the brain volume, when you have lower brain volume, you have cognitive impairment, impaired memory, poor decision making, poor executive function. So the capacity to deal with numbers, short-term memory, these all become issues.
So what age would that sort of decline with your I suppose if you're if you're a business person, is this something that can happen fairly, like 40s, 50s or something like that?
It can.
Right.
And so it's interesting because when you think about ways to protect your brain, so there is that genetic component. So there's genetic components to Alzheimer's and cognitive impairment, but there's also lifestyle components. And people will tell you that if you stay fit and you stay active, and I'm sure we'll talk about skeletal muscle and contracting, releasing myokines, which then go, some of these proteins go to the brain to help with protection and anti-inflammatory effects. But with memory, you can definitely see changes, in your 40s.
Wow. So
much younger, and people will chalk it up to say, well, it's just stress. But it's not. The brain is also an organ.
And is that something like I hadn't heard of it before. Maybe I'm not well read on that sort of thing. But it seems like it is that solid research, and is it
Absolutely.
Commonly known by a lot of people, or is this sort of people are still trying to figure out?
So I think it's interesting when we think about obesity. We know it affects 1 in 3 people, and people talk about diabetes, hypertension, cardiovascular disease. I would say most people don't relate body composition to cognitive function, but they will. So it's just that the research exists, but it always takes a lot longer from research and individuals doing those studies to then get out to the public.
Right. When you say muscle, like how much and how do you know how much you need?
What a great question. Nobody has that answer.
Right.
And that just shows you the flawed concepts. So everybody has been focusing on obesity. Professionals, it's, the failure of the obesity paradigm. When you keep looking at something and, the chances are you're going to keep getting more of that, we have a failure of the obesity paradigm. So individuals focus on adipose tissue. That's not the right tissue. We know what % body fat is too much. We know these things. I don't know what % muscle mass you should have for optimal health. Nobody does. So we've spent all our time focusing on pathology as opposed to what is possibly going to actually help. What if I could tell my husband his optimal muscle mass? That would be much more effective and efficient at finding his pathway to optimal health. But nobody can tell you that. The studies haven't been done.
Right.
The data hasn't been collected.
And do you think that's is that just because it's very expensive to do that, or very, very difficult to have the tools to be able to figure it out?
It's a good question. I think that 2 things. I think that looking at body fat where that becomes a problem is much easier. So if we know that an individual is greater than 30% body fat, we know that there's a problem. However, I don't know if we're ever going to know what % muscle mass an individual should have. I hope that we will, but it's much more challenging to look at the positive aspects, right? Because we know that an individual, depending on the person, has gotten a % body fat of 30% or more, we might see changes in inflammatory markers like CRP or ESR. We may see that. But with muscle mass, how would we determine that? It's just a challenge.
So when you're working with clients, like what do you say, how do you sort of explain to them then, if you prescribe, look, you need to build some more muscle?
Always. That's always the recommendation.
So do you just say, look, whatever you're doing is good, and just build as much of it as you can, or what do you
I mean, obviously doing a really good assessment in the beginning, because muscle is an endocrine organ. It's actually the largest organ in the body, which is an interesting concept because people think of skin or these other things, but muscle in and of itself is an organ. It is our amino acid reserve, for branched chain amino acids. It improves our survivability, just at baseline. So when working with patients, it's really about seeing where they're at, and for sure looking at the percent muscle mass they have, their body composition, and then really tracking well. So everyone has a different starting point. It's all about improvement.
Right. And in terms of the sort of training you recommend, because you're obviously working with a huge sort of variation of clients, very old to probably a lot younger.
Not so old in my practice anymore.
Right.
So I don't actually do much geriatrics anymore.
Okay.
It depends. Sometimes, yes, but very, very few.
Right. Okay.
Yeah.
So if you were working with that sort of spread of clients as an example, what sort of training are you recommending that they do then? Is it sort of dependent on the trainer that they're working with? Say, look, you need to build muscle, so go and get a good trainer and let them figure it out. Or is there certain things that can be recommended in general?
That's a really good question. And you being in the fitness industry would probably say it depends, right? It really depends on the individual goal. That being said, making sure that you're working different energy systems are very important. So yes, hypertrophy training is valuable for someone like me, because I know that is very important to maintain and build as much muscle mass as an individual can throughout their age. There's also the mitochondria type training. So doing, more endurance training, it doesn't have to be extreme, but adding in some kind of cardio component is also very valuable.
Right.
So HIIT training, functional training, heavier strength training, people should be dynamic and diverse.
Right. Okay.
Yeah.
So, but in general, it's like, right, if you're going to put together a training program, if you're going to try and find a training program, then generally you want to be doing something that's there to specifically build muscle as opposed
to and then high intensity interval training for insulin sensitivity. I mean, that really moves the needle, at least what I've seen, for body composition and inflammatory markers. So high intensity interval training, we know, improves insulin sensitivity.
Right.
And if you care about your brain and you care about your other tissues, then you care about being insulin sensitive.
So, because I'm not a doctor, and maybe people who are listening don't understand that. So what's insulin sensitivity, and what's the relevance of that?
So when you think of, let's talk about the pathology. So insulin resistance, which is what we hear all the time, is issues with subsequent development of type 2 diabetes. So you become very resistant to insulin. Your body has to produce a lot of insulin. You have difficulty getting glucose out of the bloodstream. Mm-hmm. And we know glucose is cytotoxic. So excess glucose causes issues in all kinds of ways to the body. When you are insulin sensitive, you have increasing glucose, you produce some insulin, or you release some insulin, and then you can move glucose out of the cell or out of the bloodstream.
Okay. And is it right, am I correct in this, that the best way to remove glucose from the system is through muscle?
It is.
Right.
And so training is an excellent way to, increase glucose disposal, but skeletal muscle is responsible for roughly 80% of glucose disposal.
Really?
So exercise, if you are an individual who likes eating higher carbohydrates, exercise would be very valuable, which we know that you don't. But exercise is very valuable in that way.
So staying on that point then, just so I can sort of figure it out myself. So what in most cases, I guess a lot of us, I like carbs every now and again. I guess a lot of people probably eat a lot and too many carbs.
Yeah.
So, but one of the ways, like, carbs are not great for you to have too many.
Too many. Excess is the problem.
Right.
But carbs in and of itself it's not a problem.
Right, okay.
And
But if you eat too many, that's not great for you. So your body needs to
dispose of it, yeah.
And if you don't have a lot of or great muscle, then are you going to then struggle to get rid of that excess glucose? Is that what happens?
Excess glucose, right? So your body has to get rid of it, right? Muscle is going to be the key, really, in terms of the best possible strategy. Exercising muscle is the best possible strategy to remove glucose.
Right. And if you don't have, what would happen then if you've not got much muscle condition?
So you have issues with glucose regulation.
Right.
So we know that there's issues with elevated blood glucose, diabetes, all the things that go along with obesity.
Right.
These are all things that are actually related to muscle.
Okay.
But people talk a lot about fat tissue as if fat's the driver. Fat's not the driver. It's unhealthy muscle or not enough muscle.
Right.
That's the problem.
Okay.
And it all begins in the muscle first,
Right.
which is fascinating, which is the opposite. So, when we think about obesity and we think about carbohydrates, there are two different groups. So, you were talking about too much carbohydrates is not good. I agree. There are two groups when it comes to obesity. There is the calories in, calories out group, and then there is the carbohydrate insulin model group. Calories in, calories out are you can have as many carbohydrates as you want as long as it's calorie controlled, roughly, right? Because it is about calories in, calories out. And then the carbohydrate insulin model is that any amount, too much carbohydrates, even if calories are controlled, is a problem. It's probably somewhere in the middle, right? So when you think about, excess calories, that's the problem. And excess calories in the form, no one can argue that excess glucose and excess insulin is not a problem. It's a problem. So how do you kind of reconcile the calories in, calories out model, which is important, and then the carbohydrate insulin model, which is also important? Where the middle ground is understanding that number one, calories matter, and number two, carbohydrates should be thought of in a meal-to-meal basis. It's a meal threshold macronutrient.
Right.
You're like, well, what does that mean?
Yeah.
That means that it's really about the amount of carbohydrates that you eat at one time that matters. Mm-hmm. And so for individuals, you're really looking at 40 grams or less. If you consume 40 grams or less of carbohydrates at one time, you can keep insulin in check. So yes, it's about total calories, but it's also about the amount of carbohydrates you have at one time.
And then if you add in then the muscle component, like whether you have more or less, does
Yes.
that alter that at all then?
So that is a great question. I would still recommend that you really think about that 40 gram or less per meal, but if you are exercising, you can increase that amount.
Right.
So you earn your carbohydrates. You earn your carbohydrates with exercise.
Right. Okay.
Yeah.
And then with people that are putting on weight then and coming back to this muscle thing, then it sort of sounds like that if you don't have that sort of muscle mass in the beginning, you're gonna
You have issues with blood glucose regulation.
yeah, which then
Leads to obesity, diabetes, cardiovascular disease, Alzheimer's.
Yeah.
So if people want to live long and protect their body from cardiovascular disease, hypertension, Alzheimer's, you have to deal with muscle first.
Yeah, right. And are you seeing that with? I know you've been originally working with sort of very old people. Then are you also getting them to? I guess at that stage of life, are you trying to pack muscle on those as well?
So you have a change in tissue that happens. So skeletal muscle when you're young and healthy is different than skeletal muscle when you're older. But people can always improve. What may be considered explosive and dynamic for someone who's aging or aged could be walking up the stairs. So it's really important, and that goes back to midlife, where you have to maintain your training. You have to maintain your training midlife.
Really?
And then you have to keep it up. So the concept of assisted living and nursing homes, does it have to be that way? I don't think so. I think that we end up making it so challenging for individuals to not be domesticated, right? So we have very much domesticated humans. So we domesticate humans, and when you're young, and when I say young, when you're in your 40s, you have flexibility. So you can sit all day and it's not an issue, right? But if you do that decade after decade after decade, then the later life trajectory, you can't recover from that because the tissue is less plastic as you age, right? It has less plasticity. It has, it's much more difficult to put on muscle, and part of that is through this concept of anabolic resistance. It's just that the muscle doesn't sense the same amount of protein that it did when you were younger. So when you're a kid, you can get an anabolic response with 5 or 10 grams of protein. So not much, like your kids, my kid, kids. And then midlife, you're young, you're driven by hormones. Midlife, something kind of happens where it changes and you're reliant on diet. And then as you kind of creep into that trajectory of really that later stage in life, if you don't change the protein dosing correctly, then it becomes very difficult to stimulate muscle.
Right.
It's interesting because most people are very habitual and they eat the same amount that they did in the same way that they did without adjusting for that changing hormonal milieu that happens, that aging milieu.
Right. So when you say about that, when you're in midlife, it's important to sort of prepare your muscle. Are you saying that both from your diet and for your training, it's a really important stage of your life to sort of start working out and eating healthy?
You have to. It's a non-negotiable.
Right.
Because it's interesting. So we talk about diet and exercise, and we talk about body composition, but we talk about body composition because you want to protect your metabolism. We were talking earlier about perimenopause, menopause women, typically women in their late 40s, early 50s, they lose the most amount of muscle during that time of their life. And what happens is they all have issues with cholesterol, and there's other hormonal things that come into play, but they have issues with cholesterol, they have issues with blood sugar. They almost all gain weight, right? So they almost all gain weight. And it's something that people in the fitness industry will hear all the time. And it's during this time that training is more important than ever before, because they were more flexible when they were younger. You didn't have to work as hard. You don't have to train as detailed or perhaps as specific. But, the perimenopause, menopause type time frame is really critical because they have a drop in hormones,
right.
Drop in estrogen. It's
so
interesting.
You can really to have a good older age quality of life in your older age, even if you may not have worked out when you was 20s, if you're in your sort of 40s, 50s and that,
you have to.
Getting into that is going to really set you up well for when you get older, I guess sort of help you control your weight as well at the same time.
Everything.
Yeah.
And we don't even know what that healthy aging population looks like. We don't know. Right? Because we've been so programmed to, I'm just getting older, I'm going to do less. So now, for the first time, because we have access to information and knowledge, we actually can change that trajectory. Alzheimer's might not be a, expected issue, right? Weight gain, hip fractures. These things don't have to be expected.
No.
But they will be if we don't really change our thought process and shift from this fat phobic paradigm. It's the wrong tissue. Everybody's talking about losing weight, but really what we should be talking about is gaining muscle. We're not, over fat, we're under muscled.
Yeah.
If we get that muscle right, then we don't have to worry about the body composition because that falls in line.
And just before we come off with this sort of older population, and I'm not getting old. I'm just 50 in a few months or so.
Congratulations.
But what was one of the most interesting sort of that in terms of the end of life observations that you found as it relates to health and fitness and wellness, that a few things that you thought, wow, this really outside of make sure you build good quality muscle, but was there anything else when you were sort of in that process that you thought, this is really interesting,
So there's two things that come to mind. Number one that was very interesting was the habitual patterns that they brought from their life to their aging, right? There were very specific patterns as it relates to nutrition, health, and wellness that they could have changed. And then there were other individuals that were the healthier group that were very disciplined in their practices. And the discipline was very interesting to me, that those were the groups that, I eat an onion every week, or I decide to exercise at this time and I have a gratitude journal. They were very regimented and disciplined. The other thing that I thought was so interesting to me as someone who works very hard, in the entrepreneurial space, and I'm sure as most of your listeners are also in that space, is that, I took care of a lot of individuals at the end of their life. And the one thing they said was never, ever about work. Ever. It was always about family and the relationships and the time that they spent. It was never about the things that they had, but it was all about the impact that they had on others. And that's what was so profound, you know?
And did you find that the people that were, I guess, more together at that end of their life, were they generally sort of more fit? Was there a connection between being fit and healthy to the quality that they were living at the end of their life?
Always.
Really?
Always. But, you know, it was always, so the fitter they were, you know, obviously no one is prepared for death, but it seemed, you know, they had less comorbidities, which was so helpful. You know, it wasn't, you know, 500 medications and, you know, and a lot of other illnesses. But really, though, the one thing that struck me was their mind frame, more than anything else.
Just more positive in general.
They were always more positive.
Yeah. And I guess that makes sense. Like if what you're saying is if your, you know, your waistline and your brain is kind of, you know, bigger the waistline, smaller the brain. I suppose if you are fit and healthy, and I suppose there's this definite connection with your mind and your brain, I suppose.
Yeah, and I think that you become very accustomed to thought processes, and the more you think a certain way, the more it's easier to think a certain way, and that's a translatable skill, right? So that's a translatable skill to the discipline of exercise and the discipline of having a tight diet and perhaps not being influenced by external decisions, right? Or things that might take you off your goal.
Because I guess also that must be a sort of a life mindset as well. You know, like I suppose if you're looking after yourself, like a car, you care about that and you want to protect it for a long time, as opposed to, I suppose, the opposite, where it's like, okay, well, I'm on my way out. I'm not going to care for that anymore.
You know, I think a lot of people lose hope.
Right. Okay.
And they also lose the drive and the motivation.
Yeah. And
you can't ever wait for that.
No.
Because there's a lot of times you don't feel like doing something.
Yeah.
But every time you succumb to that, I don't feel like doing something, the more likely you are to succumb to that in the future.
Right.
And that, you know, again, what I saw and what I thought was so profound is at the end of life, it was those individuals that were very mentally disciplined, and that transferred over to their physical discipline. Interesting.
Yeah. So let's talk about what to eat. And we talked about this off camera. I'm married to a vegetarian that loves animals and won't eat anything with a face on it pretty much, apart from a bit of fish. What have you found is the good and right things to eat to build muscle?
I mean, it is really not controversial that high quality animal protein is the most important substance for building muscle.
Right.
You just can't get away from that, right? So it's really the plant proteins and animal proteins have different amounts of amino acids. The amino acids in high quality animal based proteins have the right amount of amino acids to really stimulate muscle tissue.
Right.
So could you be vegetarian or vegan and build muscle? Totally. It would also be calorically devastating. So it would take 6 cups of quinoa for, I don't know, 1 3-ounce chicken breast.
Right.
But you can do it, you know, the other way to do it would be to have a lot of isolates, like pea, rice isolates, which we don't know the long-term effects of those.
Right. So because there's obviously a lot of stuff at the moment, you know, there's documentaries and books talking about plant, you know, it's a big thing even in the fitness world,
it's
plant
all
proteins.
Emotional. It's all emotional.
Right.
It's distracting. So let me start with this. The single worst piece of advice I would ever give an aging individual is to stop eating red meat. That's the single worst piece of advice. I'm a trained geriatrician have sat at the bedside of, you know, critically ill and dying patients for 2 years. The recommendation to go more plant-based in midlife is a horrible recommendation. You can get away with it if you're in your 20s. But once you hit midlife, and we talked about how muscle mass is so important, you have to be exquisitely attentive to your nutrition to the point where it would consume a lot of time if that's the choice to go plant-based.
Really?
Absolutely. Could it be done? It can be done. But it would be, you would really have to make sure you're getting enough iron and zinc, you know, selenium, and really high bioavailable nutrients.
Right.
Probably have to do a lot of supplementation. But the argument of plant versus animal, it's not really an argument. It's interesting. These are hard, fast biological numbers. Plants have a different amino acid profile than animals. Simply, right? There's no amount of arguing that would change that concept. There's also no amount of arguing that would change the concept that we need a certain amount of amino acids to stimulate muscle protein synthesis. So it's the trigger of mTOR, which is mechanistic target of rapamycin, which is exquisitely sensitive to leucine, which is one of the essential amino acids, which is in very robust amounts in animal protein.
So what about when they talk about, you know, the fact that historically we didn't eat meat?
But we did.
We did.
We did.
Right. I don't know. I'm sort of.
So documentaries are not validated with science.
Right.
Anyone could produce anything. So it's hard to argue science with entertainment. Documentaries are entertainment. Or, you know, yeah, I mean.
So we've through our history as humans, meat's been something that's been important to us.
At least for 2 million years.
Right.
It's one of the things that helped evolve our brain.
Right.
Being able to cook and eat fish and you know, substances like that.
And what about, like, I guess, and we had someone on a podcast a while ago. I guess there's good meat and there's bad meat. Where do you stand on that then?
So I think that's a very loaded question.
Right.
And I'm going to tell you why. So if I said the most important thing that you can do for your health is optimize your body composition, which I believe to be true. The way in which we optimize body composition is through proper diet and exercise, right? That's no surprise. So if I were to say, so if that's my number one priority, and then my second priority is to have good quality food, but I couldn't afford organic grass-fed meat, I would say then I'd much rather have an individual or a patient use conventional than I would ever say, eat more carbohydrates. Because, you know, the numbers indicate that we already eat more plants. Right. 70% of our diet comes from plant-based, whether it's carbohydrates or whatever it is. So I would never say omit high-quality protein because it's not organic or grass-fed.
And is there, again, I'm sort of picking up on bits of information here, but with what goes with the steroids and the food that they eat, does that not come out and sort of counter what you're trying to do?
Not at all. So the data doesn't support that.
Right.
So before food goes to market, it has to be tested. Simply. You can't have a whole bunch of hormones in your meat and it go to market.
Right.
Pea protein, on the other hand, has an enormous amount of estrogen activity. But, you know, animal-based products is not where we're getting it. Meat, you know, beef, bison, that's not where we're getting it.
And is that in terms of good protein then, is that what you're saying? you probably want to eat some sort of like beef or chicken or...
Yeah. Eggs or fish are fine.
Right.
I like what you said earlier about your wife being vegetarian, because that's probably the most relevant conversation, is that there's the emotional aspect to eating animal-based proteins that we, you know, as a group, people were not, that's the one thing that's probably non-negotiable for people. But the environmental argument, that it has to be organic argument, it's bad for your health argument, none of those hold any weight. The only argument that really holds weight is if it's an emotional for someone, an emotional issue for someone.
So how did, like, I guess people are listening to this and they probably listened to another podcast earlier where, as we all have, or seen something on YouTube where, you know, all these scientists argue for plant-based, for example. So how does the person sitting in the middle,
so hard.
Probably, how do you figure that out?
So a lot of you have to find scientists you trust. They're not all trustworthy.
Right.
Some individuals are very agenda driven, and they have a history of being agenda driven. So there's one scientist in particular that comes to mind who promotes a low protein diet because it helps with longevity. He promotes, I think it's 3 grams per pound body weight, which is well below the RDA. So there have been guidelines that say 0.8 grams per kilogram of body weight is what is necessary to just maintain health. So now we have a scientist coming out saying it's half that. It's devastating. That's not good science. But don't worry, you can buy his fasting diet, right? That's not good science. So you have to really think, does this make sense? Does protein really cause cancer? No. And in fact, there's never been any studies to prove that. But you have a group that is very agenda driven for whatever reason, because they believe that it's bad, but beliefs and facts are totally different. I mean, the science is reproducible. Randomized controlled trials of good evidence are reproducible. You can't be on the editorial board of, a journal and say that that's good quality science, because that suits your emotional belief. And it's interesting, in the realm of science, we've never had to be more aware of what's happening. It's, more aware of the delivery than ever before. It's never been like that.
How have you tried to sort of maintain your your credibility and being impartial? And because obviously, I guess you're learning about stuff all the time as well, as you have done throughout your career. How do you sort of stay true to, work out what information you're hearing, find the good people to look for the bad people? What have you done through your career?
I mean, so I'm very fortunate to have been exposed to academic individuals who have a lot of integrity, a lot of honor, and a lot of integrity that are very unbiased and very aware of their own filtration and looking at good evidence. I mean, I've been trained by some of the best. And that's fortunate. Not everybody has that network and capacity to have that kind of influence. So I feel very fortunate.
Did you search out those people?
I did.
And what did you do to find out? Where did you go to sort of say, I want this person to?
So I, Dr. Donald Layman is one of the most well-respected protein scientists. He trained me. He still mentors me. You can check out our YouTube. We have conversations every week. It's 20 years later of one of the finest scientists who has provided mentorship. And he's very good at looking at data and saying, hey, you know what? What's the mechanism of action here? Where did this come from? Why do you think that this works? And is this reproducible? This is an interesting concept, but does this make sense? And so he has a network of physicians that also provide really good randomized controlled trials that are very transparent. And then you have a other group that gets a tremendous amount of funding, some of the Ivy League schools that the recommendations, it's very agenda driven. And so how do you kind of parse that out? It's hard. It's hard for the average individual who perhaps even is in the medical profession, but not necessarily trained by a PhD. It's tough. It's tough.
So in terms of recommendations then, so I'm going to go back this weekend and I'm like, right, okay, I need to get my protein right. What is, and I guess it's different from different ages, but in general, is there a rule in terms of, one, what type of protein that you should sort of search out, and then two, dosage? So how often should I eat it? When should I eat it? What does that look like?
So, high quality protein is animal-based proteins, right? And that can be beef, bison, chicken, fish, eggs, whey protein is also good. The next question is how much, and that does vary, but a safe recommendation is 1 gram per pound ideal body weight.
Right.
And listen, you can go lower, you can go higher, but that is across the board a safe recommendation. Now you're talking about dosing. Dosing is really important, and I will say the most important meal is that first meal. It doesn't matter what time you have it, but you are fasted, you are in a catabolic state. So getting your protein dosing correct at that first meal is the most important. My recommendation would be to optimize the system at that first meal. So the body's primed for, turning over muscle, stimulating muscle protein synthesis. So that would be around 40 to 45 grams, whether you're male or female.
Really?
Yeah.
And
just get that one meal right.
Right, and that's your first, like your breakfast, if that's whenever you eat it.
Whatever time that is.
Right.
Yeah.
So about 40 grams for for breakfast?
So 40 to 45 grams for breakfast will trigger that mTOR signaling that we talked about, because that leucine content is high enough.
Right.
And that's really important. And then your next meal doesn't have to be necessarily nearly as high. You could get away with 25 grams. You know, we know that muscle protein synthesis, we know that that mechanism runs for about 2.5 hours. So then you can eat 4 or 5 hours later. Do you need to have another robust protein meal? You can, there's no harm, but really, as long as you're getting some kind of calorie, that system's already going.
Right. So you and your husband's a Navy SEAL, pretty fit machine there. What would he be doing? Like, what's his typical sort of schedule, just to give us an example?
So he eats a lot, and he's very liberal with the carbs. He runs, his idea of running for fun, you know, he runs for 14 miles for fun, right? He's crazy. But he earns his carbohydrates. So his protein intake is high. It's about 200 grams. I would say his carbohydrate intake is probably...
Throughout the day, is that? Okay.
And his carbohydrate intake is probably more than 200 grams. But he trains all the time, doesn't have to worry about body composition.
Right.
And, you know, his fat intake, he doesn't even measure that.
So what do you do if you've got, like, I guess, you know, he's obviously all over the place, you know, not knowing where he's going to be. How would someone like that, or even someone that travels, how do you sort of get that diet when you're living a real life? You know, do you supplement that to, you know, do you have to have a bag of or pouch of stuff?
No, I think you can, as long as you're wise and you know kind of what you need to be doing, which is prioritizing protein first and thinking, you know, you're not really going to exceed 40 grams of carbohydrates per meal unless perhaps you're training, then that's really a good starting point. And fat, you know, whether it's carbohydrates or fat, that's all based on appetite, what you would choose, what you would like, that kind of a thing.
Right. And what about supplement? Like, are you sort of in favor of like protein powders and that kind of thing, and supplements?
I am. So I do think that it is hard to get what you need just eating regularly. You know, I think creatine is great. Creatine is great for muscle. It's great for your brain. It's great for aging individuals. I have all my patients on a multivitamin.
Right.
Fish oil, vitamin D, sometimes liposomal glutathione, often actually. So that's the master antioxidant.
Right.
Yeah.
And what's bad for muscle? So both in diet and lifestyle?
A lot of drugs, statins, drugs, yeah.
Really? And is there anything like lifestyle related? Like, I know for guys, certainly when you get to a certain age, I'm hoping, I feel mine's okay, but your testosterone can drop.
It can, but you've been training and been fit your whole life.
And is that why it probably won't drop, like you know, if you weren't doing that, it could?
Yes, and also managing stress and recovery.
Right.
So a lot of the SEALs that I take care of in the practice, they, you know, their testosterone wouldn't be as high as you would think because their stress and recovery isn't as optimized as you would think. So I think, you know, it's very important to train hard, but it's also equally as important to recover. And that when you do that, you know, I think almost everyone is going to require testosterone supplementation at some point. I mean, I don't know. My dad is 75 and his testosterone is in the 800s. That's outrageous. He might not have to. But, you know, number one, I don't think that there's any problem with it, right? It's pretty well documented now that there isn't. But you know, it's possible that if you train and you recover and you sleep and you get the right nutrients, you can maintain optimal levels of testosterone throughout aging.
Right.
But again, we don't know what that optimized human looks like because we're so domesticated. You know, we're domesticated in our minds and in our ability to get information and our ability to push past discomfort, physical discomfort. But once you master some of those mechanisms, then there's no telling what it really looks like for aging.
And you're saying that stress does affect that.
Oh my gosh, totally. Drinking, smoking marijuana.
Really?
Yeah.
So alcohol is not good for muscle either, then?
No, it's not.
Oh
it's
dear,
not.
that's a shame.
But I mean, you know,
a few glasses of wine, is that?
You know,
are you like totally?
It disrupts sleep, right?
Okay.
It disrupts sleep. It's metabolized differently.
Do you drink?
I don't. Well, I'm pregnant, but no, I don't.
Right. So even a few glasses of wine, will that kind of affect it?
But it'd be interesting to see how you felt if you took it out.
Yeah, I do it for a period of time. I'll do several months and I'll feel great. And then I kind of start again. And I've done that for years. And I know over time, I know it's not great. And I know, like you say, I don't sleep particularly well.
Right.
And you wake up a bit groggy in the morning and it's only weekends. But it's just one of those sort of habits that you kind of stick to.
But I think being very deliberate about the habit. So if you know you're going on vacation, that might be a good time. But if you're going through a heavy training block and you know that you've got stress coming up, so most people are like, oh, I'm stressed, I'm going to drink.
Yeah.
But during the stress period is the last time you should be drinking during that time.
Yeah, that's good. So what about like your very relevant at the moment, but sort of your immunity, developing your immune system to fight off whatever kind of things are out there. You know, I've read about the link between muscle and developing your immunity. Can you?
Yeah, so this is a really newer, complex science, and this is exercise immunology. This is the skeletal muscle connection with immune health is interesting and novel. There's really good data out of Pedersen's lab, and she talks about muscle as an endocrine organ which secretes myokines.
Just for me.
I will tell you. So you hear a lot about cytokines, right? Cytokines being this inflammatory proteins that go throughout the body, like interleukin-6. Well, interleukin-6 is produced from the immune system, but it's also produced from the musculoskeletal system. And when it is produced from contracting skeletal muscle, it actually has an anti-inflammatory effect, a more immune modulating effect.
So what in practical terms, so what does that actually mean?
Resistance strain.
Okay, and you're going to sort of be...
You will contract your skeletal muscle and you will secrete these proteins called myokines that go throughout the body that have an immune modulating effect as well as anti-inflammatory.
And what I guess, you know, and I don't like to talk too much about this sort of COVID thing, but it is relevant to the conversation.
Yeah.
But I suppose with this spreading and people getting it, is, in your view as a doctor, do you think a lot of that is because there's a lot of extremely unhealthy people that don't have muscles,
Totally.
that are not eating the right stuff?
Body composition is more important now than ever before.
Right.
Survivability is directly related to muscle mass.
To what, say?
Muscle mass.
Oh, okay.
Your ability to survive any illness, any injury, is directly related to your body composition.
Wow.
That's pretty profound.
Yes.
You know? So it's interesting. It's kind of like a wake-up call for everybody.
And why do you think that it's, and I know like a lot of people who listen to this are part of the fitness industry. They've got clubs, they're trainers, and I guess they've been sort of pushing this message that, look, you know, fitness centers should be open, people should be working out. There's all kind of reasons. Why do you think that probably more people in government, and then, you know, there's some smart people from there's also some not some smart, but there's a lot of smart people in, you know, they're running these countries, and also I guess with a good medical background. What do you think about why those medical representatives are not doing more about sort of pushing these things that are obviously out there?
It's really interesting, and I think this comes down to a fundamental flaw of the way medicine is approached. It's very problem-oriented and symptom-based. So if there's a problem, I'm going to fix it. If you cut yourself, I'm going to give you a Band-Aid. As opposed to saying, you know, I have this leaky boat. I should probably plug the holes in the boat as opposed to just trying to get the water out. Right. Does that make sense?
Yeah.
Right? So we have the concept and the paradigm and thought process of medicine is, you have a high blood pressure, here's your pill for this. You can't sleep, here's your other pill for that. But, and that goes, and the government still sees it that way, and just, it's an old way of looking at medicine.
Right.
It is very unique still to this day to think about a more solution-oriented root cause approach. It's new. It means that we have to do something and that we're responsible. It's not just pharmaceuticals that will say, you have high cholesterol, here's your statin, you know? So it's just a flawed, you know, paradigm of thinking.
And you think it would take so much stress off the the hospital beds and the
It would. We know it does, but hospital beds are big money.
Yeah, I guess, yeah.
You know, and also if a doctor is willing to disseminate that information, they better be doing it. That also takes effort, you know? It's interesting because the medical profession is trained in medication management.
What
Diagnosis, medication, it's the framework for the way it functions. It's not trained in, here's your exercise prescription, here's your lifestyle prescription, here's ways that you should reduce stress, and here's how you should eat. It's not like that.
Is that because of the money in some of these drugs? And because I know my grandmother, like she's 93, and like you just wouldn't believe the amount of things she takes. I'm like, God, you know, and also the cost of these as well. You know, she's been doing this for years. I guess there must be a big financial leverage to make that.
So it's interesting, not for the physicians.
Really?
So people think physicians get money from drug companies. You don't.
Right.
Unless you are working with the company, you don't. It is not, physicians are not paid to give a prescription for a PPI, right? They're not, which is, we're not paid to give a prescription for a statin. It's a misunderstanding.
Or incentivized in any way.
We're not incentivized.
Right,
That's
okay.
illegal.
Right.
You know? So that's interesting because that is a very common misconception. I just think that the way in which medicine is developed, it's not necessarily a healing art, but it can be. And I think the most effective physicians are those that combine, you know, traditional medicine and are well trained in traditional medicine, and you combine that with more alternative approaches. And that's really the key when you think about longevity.
Right.
Yeah.
And do you think some of these doctors are just don't necessarily are trained on that? So it's like, well, look, I've been taught with medicine and how to combine these things, and that's the only way I know to fix this issue. Is that more about what
I think it comes down to the individual person. So medicine as a culture is really designed for diagnosis and treatment of illness. They don't design physicians to be free thinkers or question why this is the process or how is this going to work. But I think as we get more individuals that are free thinkers and are more creative in seeing, you know, that there needs to be a solution, then we'll start to see progression.
Is that what your approach has been?
I will find the answer, yes. People come to me because I'm the last stop. So they've seen 14 other physicians, and I'll find the answer. I won't settle.
Yeah.
There's always a reason why, you know, and very rarely is that reason is just genetic. That's not true. So you have to find whatever that reason is.
Does that sort of kind of from, I guess that you kind of get these communities, I suppose, in all businesses. When you are a little bit more of a free thinker and on the cutting edge, does that sort of push you out a little bit from, you know, the sort of, do people sort of like look at you a little bit differently within the professions?
No, because you earn your credentials.
Okay.
So one of the things I did is I became very credentialed. I mean, I did my fellowship at WashU. That's one of the most well-respected institutions in the country. So then if I say, okay, well, here's my opinion, I'm trained in this, it's not, oh, I mean, you know, you just got your degree online. No, I didn't. I spent 17 years. I did 2 residencies and a fellowship. So you earn that credibility.
Okay.
You know, I put in my time.
Right.
So you get more people that put in their time than their opinion. There's a weight of an opinion. And also an openness to learn. I ask my colleagues all the time, hey, have you seen this study? What do you think about this? I still stay in contact with the professors and the academics at WashU, right? Because that's where all the changes are happening. So I think that, you know, you have to be unwilling to settle, but you also have to put in the time to earn the credibility and to be taught how to think outside the box, right? You have to be taught to think and analyze information, analyze data, and be okay with being wrong.
Right. Because that point you made there, be okay being, because I was going to sort of ask that. I suppose when you've got those credentials and that title, for example, it's like, well, look, if I am wrong, you know, this could blow my whole career, this could destroy my reputation.
But in education, it's all about learning knowledge.
Okay.
And you learn and things change and you get more information. And it's really, I think, true wisdom comes from being able to be flexible and say, you know what, I was wrong on this.
Yeah.
Yeah.
I agree. I suppose for me thinking it would probably be one of the things that may stop more of that kind of, pushing the boundaries, because you are going to fail. It's like, in business,
going to be wrong.
you fail.
Oh my gosh, I messaged my one friend who's a PhD, and I'm like, oh my God, I said the stupidest thing about gluconeogenesis. I have pregnancy brain. I was exhausted. And he's like, just go in there and say you're wrong. And I was like, oh yeah, okay, just do that.
Yeah.
And that's okay.
Do you think other people in that world, though, are scared of, because you seem as though you're probably someone who don't care what people think, like if they disagree with you, like, well, sorry, I'm going to keep pushing. But do you think that might stop certain people from doing that?
Yeah. I mean, oftentimes on my social media, I'm just so sick of it. It's so cumbersome, but it's my responsibility. Yeah, there are times where I'm like, oh, I'm going to post this and this is going to be, so controversial. But there is a level of responsibility. Yeah.
Have you found at the moment, like in the world today, that sort of sensitivity from people, because you got a big social media following, is it a lot, are people more touchy about what you put out now than probably what they were previously this period?
They're equally as touchy. Really? They're equally as touchy. It's very emotional. Yeah. Yeah.
So moving on, just I said to my wife I'd sort of ask a little bit about this, but muscles for women, what, I suppose a lot of time people think, well, I don't want to build muscle because it's, I'm going to build on size, and is it, is it something I should do, and can I do it? What are some of the, I suppose, things you've learned from trying to explain this, and what is I guess some of the advice you can give for people that are thinking about, I guess there's two big things here: one, eating more protein, and particularly animal protein, and two, you want to put on more muscle.
It takes a lot of effort to put on muscle. Women think, oh man, if I lift that 15-pound weight, I'm definitely going to get big biceps. You know how hard it is to put on muscle? Yeah. My husband was just talking about that going in. There's no guarantee. But what it will do is it will change body composition. You'll look better, you'll look tighter, probably have more energy. You'll be able to manage your diet better, meaning you'll be able to manage your glucose better. It is very challenging and the most important task that you take on. Right. Women absolutely have to work, because as they age, the hormonal decline works against them. Right. So really putting on muscle and really optimizing for protein is again, a non-negotiable. Right.
And my mum, for example, like for her as well, like in terms of training, would you be saying to her that she should, be upping her weight and
So your mom is 95?
No, that's my grandma.
Okay.
My mum's 73.
Okay.
So would that be something that you would?
So for her, I would say, and this is really good data out of Stu Phillips' labs, who works a lot with this population, is that she should do higher volume. Lighter weights, higher volume. Oh. But she should do things that it's hard to do. Yeah. She should not domesticate herself, which is the natural inclination.
Right. And the same applies to her, getting more of that sort of protein intake, even
it's even more important in her.
Right. Okay.
Yeah.
That's strange that sort of I wouldn't have necessarily thought that about, like particularly sort of advising my mum to do that, but
and get her first meal of the day correct. Get her first and her last.
Yeah. So just before we wrap up, I've got a couple of questions I want to finish off with. But if people are interested in finding out more, because we've skimmed across the surface of a lot of, I suppose, deep information that you spent years studying. How can people sort of go into a little bit, search you out, find a bit more information, learn a bit more?
Right. So my website is Dr. Gabrielle Lyon, and I have a great newsletter that has validated science information that I think is really well done. And so they can sign up for my newsletter. I also have conversations with my mentor, Dr. Donna Lehman, on my YouTube channel. And I really do this because I want him to be able to reach the public. And he wouldn't do that otherwise, right? He's fine just doing research and writing papers, but his information is so valuable that people don't have access to an individual like him. I mean, he is a world-class researcher. So I interview him in depth and we talk about our experiences every week. So they can sign up for that on my YouTube. Right. And I have a really interesting protein cycling course coming.
Protein cycling course?
Yeah.
So tell us what's that going to, well.
So, we talked about the evolution of information. And if people follow me or are interested in some of the content I put out, which I really work hard at putting out a lot, I always talk about protein in an even distribution throughout the day. That might not necessarily be what we need to do,
right?
Which is interesting. So this is all, of course, about really the concept of protein cycling diet, my protein cycling protocol, and it really is about getting that first meal right and maybe allowing that second meal to be lower in protein, and then the subsequent meals, depending on your goal, more robust.
Right.
So you can continue to stimulate muscle tissue.
And is that research on protein, is that still fairly new then? Are we still, are we still learning a lot more about that?
So there are core fundamental principles that really haven't changed.
Right.
But the integration of the information and really thinking about how that's applicable is and can have some nuances.
Yeah.
So.
Excellent. So final question then. Escape Your Limits is about escaping what you've believed is impossible and gone on to make it possible.
Yeah.
What would be an example of where you've escaped your own personal limits?
So this is interesting. I would say in education, right? So growing up, people say, why would you do that? That's so hard. Or, why don't you just marry someone rich and go be a flight attendant, which there's nothing wrong with that. But I would say, when people would say, wow, you can't do that. I'm like, okay, watch me, and it's just this constant drive for personal excellence through education.
Right.
Yeah.
Where did that come from?
Really stubborn, just like my daughter. But, I think that, there's just an internal tenacity just for continued self-improvement, because I'm very aware of the exquisite shortness of life, And so to continue to drive and compare myself to myself is really what has helped so much. And it allows for exponential growth after that.
Fantastic. Well, there's some great lessons there. I've certainly learnt a lot, and I've made me think I've got so much more to learn as well after this conversation. So thank you so much for your time.
Yeah.
Maybe when you're back over this side, we'll have to have a part 2 when my knowledge is a little bit higher on the subject and I've been able to sort of make an impact on my mum and my wife. Not to say they need it, but
yeah.
So Gabrielle, thank you so much.
Thank
Appreciate
you.
your time. Thank you. Hey, I hope you enjoyed this podcast. If you did, then please go over to iTunes and subscribe to the Escape Your Limits podcast. Leave a review, leave a comment. It really would help us a lot to continue to keep these going.